to part 3 of Refugee 101. This session is entitled Challenges and Supports. My name is Gretchen Schanfeld. I'm the Director of Health and Wellness at Nationality Service Center in Philadelphia, as well as the coordinator of the Philadelphia Refugee Health Collaborative. Hopefully you've had the opportunity to join us for the first 2 sessions on this Refugee 101 series of 3. This session is designed to help familiarize you with some of the supports available for refugees in the local Philadelphia region. So today we're going to quickly revisit some of the barriers encountered by this population, but spend most of our time focused on local resources that are available. So revisiting this definition of a refugee that we learned about in session 1, a refugee is a person who has a well-founded fear or history of persecution for reasons of membership in a particular group, whether that be a racial group, a religious group, a particular nationality or political opinion, who has fled and crossed an international border and is unable to return to that country. Here in Philadelphia, approximately 800 refugees who meet this definition are arriving annually through 3 local resettlement agencies. Additionally, Philadelphia is home to a number of other programs and services that are unique to our region and can support the clients that you're working with. So as we revisit the definition of a refugee and the 800 arrivals to our city on an annual basis, it's also important to remember some of the particular communities that we're working with. These are listed here, and as was mentioned throughout the first 2 webinars, we invite you to check out our website, philarefugeehealth.org. Under the section for providers, there's a section on refugee backgrounds, which can provide a really in-depth and needed information on each of these particular populations. So for these 800 individuals arriving on an annual basis, what are some of the challenges that they face? We've talked in seminar 2 about language barriers as well as struggles in navigating systems, as well as health issues, which we'll talk about a little bit more today, and just an overall learning a new context, a new country, the systems that go with it is challenging, and our role is to help support our refugee families and individuals as they navigate that system. Before you see a list of resettlement services upon arrival. So these are a selection from a list of the many core services that refugee resettlement agencies are required to provide upon arrival. These include services and supports directly upon arrival, such as picking people up from the airport and providing an initial meal, as well as securing housing and furnishing that housing. After that, the process begins to get refugees established through obtaining documents like Social Security cards, needed benefits, and then enrolling children in school, the medical screening we'll talk about in just a minute, as well as employment and ESL referrals. The other main role is that of a teacher, of providing orientation to the many complex and diverse systems that these families need to master upon arrival. That includes a health orientation, which we'll talk about a little bit more, as well as a lot of both classroom, one-on-one, and guided interactions such as banking, maintaining the house, et cetera, et cetera. Within all of this, I think it's also important to remember the various phases of adjustment that individuals may go through. If you can put yourself in the shoes of a refugee, you can imagine moving halfway across the world. You may or may not understand the language. You are likely not from you may not be from a city, and so there are various reactions that you may have at different times. At first you may feel excited and relieved. You're finally in a place that is safe and that you feel like you can make a home. But then often reality sets in, may not be exactly as you imagined it. There may be challenges which may cause disappointment, anger, fear, confusion, or frustration. That's a natural stage that everyone goes through, and then it's really up to us to support clients in taking this road of negotiation and integration. You know, supporting our clients to take initiative, take action to move ahead, to define new roles and identity, and move towards strong social adjustment and self-sufficiency. Unfortunately, you will at times in this work see clients that are moving towards this alienation, marginalization phase, and that also, you know, can occur, and it's our role to really support people in moving towards the negotiation and integration side when they are moving towards that. So getting them connected with some of the needed supports and services we're going to talk about today could be a helpful part within that. So let's take a closer look at health access. As you saw, this is one of the major core services that refugee resettlement agencies provide, and is very important as a building block to many of the other next steps in terms of employment and education. So taking a look at health access, there are some inputs that are important to recognize, that many refugees have had lack of access to quality care prior to arrival. They all have had, or most have had, a health screening just prior to arrival. There are some exceptions to that we'll talk about in just a minute. But many have had limited access to any preventive health care and may have unmanaged chronic or serious conditions. With that knowledge, I want to move into a little bit of the history of the Philadelphia Refugee Health Collaborative and why we're providing these webinars in this way today. In 2005, about 300 refugees were arriving to Philadelphia on an annual basis, primarily to establish communities, Liberian communities and some others. And when they arrived, they were being referred to the physicians that their friends or family were already attending, as well as to public health centers or private physicians for screenings only. But taking into account some of the factors we described on the last slide of a need for a higher level of care, for access to quality preventive health screenings, and really an increase in the number of significant medical conditions we were seeing, we needed a different model. We needed something that was a little more targeted to the particular needs of this vulnerable group. Fast forwarding to today, this Philadelphia Refugee Health Collaborative is a collaborative of Philadelphia's 3 refugee resettlement agencies alongside 8 university hospital-based clinics that each dedicate a morning or afternoon to the care of refugee patients. So if you're a medical resident watching this presentation, you may work at one of these clinics, or if you're on the refugee resettlement side, you may have the opportunity to escort to one of these clinics. This is a unique model in that it not only provides the refugee health screening, which is a requirement, but also provides ongoing access to care. These sites are also primary care sites that can provide long-term care to these refugee populations. So what is the role of the resettlement agency within this health access? Certainly pre-arrival, we are organizing and preparing, perhaps even scheduling blood work, health orientation, and screening appointments prior to arrival, as well as preparing for high-need cases in consultation with our clinical partners. After arrival, we are enrolling refugees in the appropriate medical assistance program, either Medicaid or a specialized program called Refugee Medical Assistance. We're providing orientation. We are escorting refugees to their health screening and to first specialist appointments to help familiarize them with the health system. We're also functioning as a clinic liaison to partner refugee health clinics. So we actually designate a staff member to attend the clinic on a weekly basis and help coordinate clinical care. And we can also support access to some of the supportive services that we're going to talk about later today. So another summary of kind of what resettlement provides, certainly orientation, enrollment in those Medicaid programs, and escorting are some of the primary roles. Additionally, many of the resettlement programs locally have medical case management programs for complex cases. So let's take a little bit of a closer look at some of these. First, we'll talk about the health orientation. So the health orientation is about an hour-long interpreted session that refugees receive in their native language as an attempt to orient them to the U.S. healthcare system. Now, as you can imagine, an hour on our very complex medical system and healthcare setup is not enough, but we do try to cover the basics of health insurance, what to expect at your doctor's office, things like HIPAA and confidentiality, prescriptions in the pharmacy, specialists and referrals, and sick visits and emergencies. If you're interested in learning more about this health orientation, there are videos on the same YouTube site that you can take a look at. So moving on from orientation to insurance. So refugees receive a special type of Medicaid called Refugee Medical Assistance, which covers all medical services, prescriptions, dental care, and it's administered in much the same way that other Medicaid patients would be administered through one of the Medicaid HMOs. With the advent of Medicaid expansion in 2015, eligible refugees can continue on Medicaid in the long term, including those with low income or those with particular medical need, including children, and as well as children and the elderly. Patients who don't qualify for Medicaid can enroll in the Affordable Care Act, and there are ongoing outreach and enrollment activities to make sure that people are able to continue to be insured in the long term. So moving on to touching on some of the clinical side. So we know that prior to arrival, refugees have a health screening. This is true for all arriving refugees. The exceptions are a small number of individuals who are arriving through the Special Immigrant Visa Program. These are primarily Iraqis and Afghanis who have served alongside the U.S. government or the U.S. military and are receiving a special immigrant visa as per their participation with those with that type of employment. They do not receive an overseas medical screening, and you will really be starting from square one in terms of patient history. There's no recorded documentation. However, for all other refugees, which account for over 90% of our arrivals to Philadelphia, they do receive a medical screening overseas. You should work with your clinic director and your clinic staff to find out how you get access to this overseas medical screening, either through the EDN system directly or through passing on the information through your clinic liaison. This can provide a basic point in time information about a patient's current medical state. It can be completed up to 1 year prior to arrival, and it really is designed to primarily look at infectious disease, although as you can see it includes a review of some other systems as well. But it can be a good starting place for clients where for patients where there isn't a lot of documentation. This can be the starting place. At the domestic health screening, you'll also be looking at a number of other areas. I'm not going to talk in depth about the clinical components of the domestic health screening or care for refugees, but I invite you, there are a number of other webinars and other resources posted on the PhiladelphiaRefugeeHealth.org website, which which can be helpful if you're seeking additional clinical support. The domestic health screening, however, does include a number of components, certainly following up on infectious disease screening that's been done overseas, including TB, providing additional immunizations. There are an increasing number of immunizations being given overseas prior to arrival, but finishing out those immunization schedules, as well as beginning to manage some of the chronic disease and beginning to work on preventive health screenings and things of that nature that, as we know, may not have been available overseas. So let's talk a little bit about supports. So one of the main support at your clinic is the clinic liaison. This is a staff member or an intern who will attend the clinic with the clients and be available to support your work. They will take any specialist referrals and assist in facilitating those. They can provide access to the pharmacy and really serve as a client advocate through systems. They'll also be the one that can assist with further health education and things of that nature. So specialist appointments, we can help. This is the first of many supports we're going to talk about today. You can ask your clinic liaison to assist with scheduling of specialist appointments, such as if a patient needs to get a follow-up x-ray or a cardiology appointment. Your clinic liaison can help facilitate that process. Other available supports, there are a number of mental health supports that we wanted to touch on today. The first is clinical mental health supports. Certainly, these refugee patients are eligible for clinical mental health services through community behavioral health. Your clinic liaison can assist in scheduling and escorting to that initial appointment. Or if the client is further out of the resettlement period and has been in Philadelphia for a number of years, you can refer directly to clinical mental health services via community behavioral health. However, with that said, many of our clients may not be immediately comfortable with pursuing clinical mental health services. It may be an unfamiliar concept, or they're just not ready for that step. So you can look at, we also are going to talk today about community mental health interventions, everything from ESL, case management, as well as the Philadelphia Mental Health Collaborative. Your clinic liaison can also assist in connecting you to these services. But I want to talk in particular about the Philadelphia Refugee Mental Health Collaborative. This is a local collaborative which provides a variety of community building and support services to refugee communities to support emotional health and well-being. You can check out their referral form at lcfsinpa.org. As well, there are links and more information on the philarefugeehealth.org website. So beyond mental health, there are some other available supports. There are a number of employment programs available for refugees. We know that employment can bring a sense of purpose as well as a financial benefit to families, which both reduce stress. You can refer the client back to their local county assistance office. Most clients will know where that is located, or you can talk to your clinic liaison to get more information about that. Another service I wanted to make you aware of is the Philadelphia Partnership for Resilience, the PPR program. This program provides case management, legal, and other supports to survivors of torture in the greater Philadelphia region. We know that about 10% of immigrant and refugee clients in medical settings are survivors of torture. The philarefugeehealth.org website has a referral form as well as a screening tool which can help you in screening and referring clients who have experienced torture for additional supportive services. Finally, I just wanted to provide you, I mentioned this website a number of times, and I hope this can become a great resource for you as you learn more about the great local supports available to this community. So I invite you to check out philarefugeehealth.org, and thank you very much for your time.